Welcome back to Healthy Communities News. I'm Hilary Russo. Today, we're in Nashville, Tennessee, a city famous for its live music. But we're going to what's often the center of the neighborhood, a local barbershop. Barbershops are not just places to gather, get a haircut, and discuss your favorite sports team. These community hubs also have the potential to become places to provide much-needed healthcare services. Together, CVS Health, Vanderbilt University Medical Center, Nashville Health, and Cedars-Sinai Medical Center are working to place pharmacists inside barbershops so they can assess whether patrons have high blood pressure and recommend necessary treatments. A similar program recently proved effective in Los Angeles. Gerard Parrish, a clinical pharmacist with Vanderbilt University Medical Center, is helping to lead the effort within Nashville barbershops.
Mind if we check your blood pressure today?
Yes, sir. Hypertension is what they call the silent killer. You can have congestive heart failure, it can cause vision issues, it can lead to kidney disease.
Dr. Andre Churchwell is Chief Diversity Officer for Vanderbilt University.
Some of the highest rates of hypertension, the highest rates of complications of hypertension are in this area that we're living in. For an African American, that hypertension has a more dramatic effect. The strokes are bigger, the heart attacks are larger, they're more massive and more lethal.
High rates of hypertension in this community are compounded by the fact that African American men often aren't receiving regular medical care.
Our return rates to our clinics were less than 50%. There's just the trust and anxiety about coming back to a hospital, and the barbershop is a place where people are comfortable.
What's going on, young folks? You back?
Barbershops offer their patrons much more than mere grooming services, according to shop owner Andre Southall and his customers.
The barbershop has always been a pillar of the community, particularly in the black community. You have a barbershop on almost every corner.
A barber's almost like a pastor. You can talk about almost anything with him.
I've been going to Andre since I was probably about 10 years old. He's been there, seen me grow up, gave me a lot of wisdom.
My girl says thank you. Dre's like an uncle, and I always get like some interesting tips from Dre.
People are coming here every week. Most people don't even go to the hospital once a year.
For real? Yeah.
I think as men, we don't go to doctors enough. We kind of put things off, but we love going to the barbershop. You got to meet the people where they are.
I think that the barbershop is just the perfect place for people to come and while they're sitting waiting to maybe get a blood pressure check.
Getting screened in the barbershop will probably result in people getting the results faster and more frequently, so they'll be more aware of what's going on with themselves.
That's certainly the hope of Dr. Henry Okafor, the director of the Vanderbilt Meharry Cardiology Program, who's serving as the physician champion for the Nashville Study.
We hope to get many more men to recognize the importance of checking their blood pressure and hopefully spread the word through the community.
Way to go.
If we help create that awareness and help people to initiate treatment, we think we can get Nashville to be healthier.
Hey there.
Hi.
My name's Adair.
Adair Blyler, a clinical pharmacist from Cedars-Sinai Medical Center, talked about her role in the success of a groundbreaking barbershop study that was conducted in Los Angeles.
Our plan was always to roll this out across the country. Now we've moved to Nashville, and this is the next step. After 6 months, we saw a 21 millimeter of mercury greater blood pressure fall in the intervention group, and we were able to sustain those results an additional 6 months. I think lots of people have had their lives changed by this, which is really exciting to see.
You're a healthy young man, yeah?
The pharmacist is going to have a lot more time to spend with the client to ask and answer any questions to understand their treatment.
Do you know what your blood pressure usually runs?
I don't. Me and my wife, we got married here. We just had our first child here. So this is a community that I plan on being in for a while, and I will be helping monitor patients' drugs. I'll be helping change medications. I'll be helping monitor the blood pressures. And also, if they have any side effects, I'll help with that.
Good, man.
Clearly, the key to this program is relationships. The relationship among barbers and their clients, as well as the relationship between the barber and the clinical pharmacist. Vanderbilt's Dr. Alpa Kisler, one of the study's directors, talked about how they're setting up for success.
There are two specific components of this study. One is the pharmacist, who's knowledgeable about the medications that need to be utilized, and then the barber themselves.
They're the liaison, basically.
They are the liaison, but they have a significant involvement. They are really involved and engaged in this.
We want to be able to make sure that people are getting the proper education about their health and be able to be that liaison.
Former U.S. Senator Bill Frist, chairman and founder of Nashville Health, highlights what this study could eventually mean to the health of Nashville residents.
The most successful innovation happens through collaboration of relationships and resources. The data that will come out of this study has the potential to be groundbreaking. If we can identify more African American men who have hypertension, and we can help them control it, then we're literally saving lives.
This is a dream collaboration with the community. If you prevent a stroke, a heart attack, prevent someone from having kidney disease, that one life is all that you need to get up every day.
No, I'm looking good.
At CVS Health, we're all looking forward to seeing the results of this study and what they might mean for our efforts to make healthcare even more local in the future.
I'm gonna see you soon.
In the meantime, visit our site to hear about more communities that are working with residents to help them get and stay well. We'll see you soon.